A J-tube, otherwise known as a jejunostomy tube, is a feeding tube that's placed into the small intestine. The reason that it's placed into the small intestine is that it is below the point of the operation. So we wouldn't use a feeding tube into the stomach, we would use it only in the intestine because that's how we need to feed the patient after the surgery. Oftentimes after a major abdominal surgery, the appetite is pretty poor. You'll eat and you get full very quickly. So by having a feeding tube in place, it allows you to get some extra nourishment, specifically calories and protein, which will help your healing. When we place the J-tube, it's something that the physician will discuss with you whether or not you need it. Typically though, Whipple procedures and total pancreatectomies usually warrant the need for a feeding tube. Distal pancreatectomies, usually we don't need to place a feeding tube. The recovery is a little bit quicker from a nutrition standpoint. The formulas that we use for a J-tube when we feed the patient is something that's a little bit different than what you might think of when you would drink a can of Ensure or a can of Boost. The formula is specifically formulated for the type of surgery that you've had. So the formula in itself is a little bit lower in fiber, it's lower in fat, and the protein is already broken up. So the protein's broken down so it's easily absorbed into your intestines and you can utilize those calories. The formulas that we use in the hospital are specific to the patient, like I mentioned, and if you didn't tolerate that formula, we have other options for you. The feedings run over 24 hours a day and they run at a very low rate. So as you eat and your diet is advanced, then we also will advance the feeding tube as well.